Hey, Dylan.
I call the January 4th, 2021 Organizational Board Meeting to order. Welcome and Happy New Year, everyone. At this time, I will accept nominations for temporary chair. Legislator Forsythe?
I'd like to appoint Mr. Akers.
Second.
Seconded by Mr. Lightfoot. Are there any other nominations? May I have a motion to close the nominations for temporary chair?
Make that motion.
Legislator Denisha? Is there a second?
Second.
Legislator Forsythe seconds. All in favor of closing the nominations, please say yes.
Yes.
Is there anyone opposed? Seeing none, motion is carried. Now the vote for temporary chair. All those in favor of Mr. Akers for temporary chair, please say yes.
Yes.
Is there anyone opposed? Seeing none, Mr. Akers will serve as temporary chair for the portion of this meeting. If you'll give us just a moment, I'll wipe down the dais.
Okay, welcome everyone. First up is a motion for suspension of the rules. Mr. Lightfoot, seconded by Mr. Forsythe. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Okay, roll call for attendance. Ms. Kelly?
Reagan.
Here.
Let it echo.
She's on two screens.
Here.
Lightfoot.
Here.
Sheridan.
Here.
Get me.
Smathers.
Here.
Denisha.
Here.
Perkins.
Here.
Akers.
Here.
Fay.
Here.
Haggard.
Here.
Fiacco.
Here.
Burke.
Here.
Arquette.
Here.
Terminelli.
Here.
Curran.
Here.
15 present.
Okay, thank you. So next up is the prayer. I'd ask Larry Denisha to offer the prayer. Would please stand, and we'll follow that with the pledge of allegiance.
Thank you, Mr. Chairman. We bow our heads, please. Dear Heavenly Father, we give thanks for the democracy alive in our country and for the freedom to gather here this evening. We gather here to reflect upon yet another year that has passed, but more importantly, to prepare for the upcoming year and the challenges and responsibilities that we will face as elected officials and representatives of the people of St. Lawrence County. We ask that you send your creative spirit upon us and enable us to draw upon the wisdom and experience of yesterday as we respond to the questions and concerns of tomorrow. Give us the confidence to speak the truth, boldly, yet with kindness. Give us the patience to listen openly to one another without prejudice. Give us the wisdom to discern what is right and just. Give us the strength and willingness to prepare to explore new possibilities. We ask that you guide us on our journeys home at the end of this evening and grant us all a safe return. We ask these things in the name of our Lord and Savior, Jesus Christ, through whom all things are possible. Amen.
Thank you, Mr. Denisha. pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, I'll accept nominations for chairman. Mr. Forsyth.
I'd like to nominate legislator Sheridan.
Seconded by Mr. Lightfoot and Mr. Denisha. Are there any other nominations for chair? Mrs. Haggard.
Thank you, Mr. Chairman. Because these are the most difficult and unprecedented of times, I feel that a person with compassion, experience, and the ability to be all-inclusive should be nominated for chair. There's an individual on this board who possesses all these qualities. He has the skill both in government and public service to focus this board on the needs of all our citizens. It is my great honor to nominate Mr. John Burke, legislator from District 12, as our candidate for chairman of the St. Lawrence County Board of Legislators.
Is there a second? Second by Susan Fiacco, Tony Arquette. Nicole, did you have your hand up also? And Nicole Terminelli. Are there any other nominations? Seeing none, may I have a motion to close the nominations for chair? Moved by Mr. Smithers, seconded by Mr. Lightfoot. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed, motion carried. So that's all taken care of. So now we will have the vote for the chair. Please state the name of the person you are voting for. Ms. Kelly.
Reagan,
Sheridan.
Forsyth,
Legislator Sheridan.
Lightfoot,
Legislator Sheridan.
Sheridan,
Sheridan.
Smithers,
Legislator Bill Sheridan.
Denisha,
Legislator Sheridan.
Perkins,
Sheridan.
Akers,
William Sheridan.
Fay,
Burke.
Haggard,
Mr. John Burke.
Fiacco,
Burke.
Burke,
Burke.
Burke.
Arquette,
John Burke.
Terminelli,
John Burke.
Curran,
Sheridan.
9 for Sheridan, 6 for
Okay. At this time, I would ask Mr. Sheraton to come to the dais.
Needs to have an amendment, or I can speak to it at that time. So you can call me at that time.
Okay, there's an amendment.
Yes.
Amendment's going to be
So because we changed per observer, it would be back-to-back years. We need to just start the rotation over again and amend 25 to not enter this week.
So we're gonna put that one down here, this one up.
Okay, we're just gonna start the rotation over again. So there's 4, and then it will just start again. Right, so then the next time it'll be Watertown and Tribune and like that.
Okay.
So the only change will be strike Courier, add North Country this week.
Screw for there. Okay. Good.
First of all, I'd like to thank the legislative body for selecting me as your chairman. I consider it a great honor. And today we work side by, well, we'll just skip over that part of it. We'll try to keep it short. Just wanted to let you know that I'm going to be looking forward to working with the dedicated administration staff here, with Ruth, Kelly, Rebecca, and Dylan, and the department heads. And the board should be proud of the accomplishments that it's had over the last 4 or 5 years. We're no longer have to borrow millions of dollars every year to make the payroll. We're off that fiscally distressed list that the controller has out. And we just received a great credit report. And so we need to continue to build up that fund balance for the bad times that could lie ahead, especially with the state of New York being billions of dollars in the hole. And so I know that sometimes we have our differences of opinions here in these chambers, but I think that when it gets right down to it, that we all have something in common, and that is that I believe that we all vote in the best interest of the people who put us here in the first place. I would like to say I realize it's a big job. It's especially going to be a big job to fill Joe Lightfoot's shoes. He's done an incredible, great job as chairman, and I will relate a little bit later on in terms of some of the things that he's oversaw in terms of our governance over the last year. This chairman's job will be a little different job than what I'm accustomed to during my last 10 years on this legislature, but I'll try to be fair and open-minded to both sides of the aisle when I'm doing this job in the next year as your chairman. Just wanted to let you know some of the things that you should be aware of that we have been able to accomplish as a board over the last year. And some of the things have been written down here. When I look back at it, we see that St. Lawrence County is immediately engaged in and continues to manage the global COVID-19 pandemic at the county level for its residents while maintaining staffing levels at 800, a little over 800, and continuing to hire to meet increasing demands in public health, Office of the Aging, and so on. And many thanks goes to the staff here and at this county for their tireless efforts to stop the spread of this COVID-19. It's been an interesting year, to say the least. We've transitioned rapidly to provide telehealth services from mental health and addiction treatment for the citizens in this county. We've managed to construct 3 towers as part of our interoperability project for emergency communications in Governor, Hammond, and Waddington. The correctional facility upgrade to security software was a 10-year-old facility in law enforcement integrated technology with Augsburg, Messina, an upgrade for Potsdam. We've negotiated a 1-year solution to sales tax distribution with the city of Augsburg. We've negotiated and settled 4 collective bargaining agreements for 5 years with CSCA, CSA Solid Waste, Council 82, or Corrections, and Indigent Defenders. In 2021, the budget was adopted with a reduction in the true value tax rate of 9 cents per thousand. There's something to be proud of. We hope that we continue along those lines in the future. We hired a new department head for the county of Department of Social Services. And we also hired a new department head for the Youth Bureau, and extraordinary repair and construction year for the Highway Department projects. And it's continuing into 2021. And our recycling efforts transitioned to Dank site in Harrisville, and solutions continue to be sought for reducing costs to the public and managing the extraordinary change in the market for recyclables. And some of the goals that I would like to have us entertain for this upcoming year would be to refocus the feasibility efforts on that future plan, the future plans of the former correctional facility at the courthouse campus, the old county jail here. And the Space Committee will be tasked to bring a report to the full board this year. A long time ago, when I was on this legislature, I introduced a resolution to reduce the sales tax on home heating fuel. That was a very long time ago, and it failed, and it has not ever been resurrected in terms of any success with that. But I'd like to see that change. I think that we should be looking at reviewing the options of reducing the sales tax on home heating fuel that was last considered in 2007. With that, it looks like we got a pretty good idea of where we've been, and we've been doing well. And I hope to continue to follow those same footsteps that Joe left us, or let us follow with him down that lane of success for the financial picture for St. Lawrence County. We're looking good, Joe. Thank you. With that, I would like to go on to nominations for vice chair. And so at this time, the chair would entertain a motion and a second for vice chair. We have a motion from Mr. Lightfoot, seconded by Mr. Motion by Mr. Lightfoot.
For legislator Larry Denisha.
Motion on the floor for Larry Denisha, seconded by Mr. Forsythe and Ms. Kern. Anyone else? Second? Yes, Mr. Akers. Okay, we've got a motion. It's been seconded. Is there any other motions to come before the board for chair? Ms. Terminelli?
Thank you, Mr. Chairman, and congratulations. I would like to make a motion. I would like to make a motion nominating legislator Tony Arquette from District 13 to serve as vice chair of St. Lawrence County Board of Legislators. And if I may, in the 2 years that I have had the pleasure to serve as county legislator, I've been witness to the proven leadership of Mr. Arquette. He has served as a mentor to us newly elected officials, providing guidance and background information, as well as educating us about parliamentary procedure. His long-standing experience in support of labor unions has allowed him to refine his negotiation skills and listen to both sides of every issue, making non-biased decisions that will benefit the majority of the group. And this has earned him great respect. Mr. Arquette is knowledgeable and well-spoken about the many facets of our county government, conversing frequently with his constituents employees, and other stakeholders. And as the vice chair of this board, Mr. Arquette would work across the aisle and alongside his colleagues to gather information and seek solutions that will move our county forward. It is with honor that I make the nomination for legislator Tony Arquette to serve in a leadership role representing the interests of the constituents of St. Lawrence County.
Do we hear a second to that nomination? Ms. Fiacco seconds it. And I think Dan Fay looks like, and Mr. Burke seconds. I would make I entertain a motion to close the polls. So moved by Mr. Akers, seconded by Mr. Forsyth. All in favor?
Aye.
Carried. Okay, let's have a voice vote on which candidate you would like to have as vice chair. And go ahead, Kelly. I think you've got the roll call.
Reagan,
Denisha.
Forsyth,
Legislator Denisha.
Lightfoot,
Legislator Denisha.
Sheridan,
Legislator Denisha.
Smithers,
Legislator Denisha.
Denisha,
Denisha.
Perkins,
Denisha.
Akers,
Legislator Larry Denisha.
Fay, Fay,
Dan Fay. Arquette. Okay.
Haggard,
Tony Arquette.
Fiacco, Burke,
Tony Arquette.
Tony, or Arquette, sorry,
Arquette.
Terminelli,
Legislator Arquette.
Curran,
Larry Denisha.
9 votes for Denisha, 6 for Arquette.
Congratulations.
Congratulations, Vice Chairman Denisha.
Thank you for the support.
Next on the agenda is the approval of the agenda. Do we have a motion to approve the agenda? Go ahead, Ms. Kern, and seconded by Mr. Smithers, and seconded by Mr. Forsyth. All in favor?
Aye.
Opposed? Carried. Approval of the minutes for the December 7th, 2020 and December 21st, 2020. Do we have a motion? Mr. Lightfoot, Ms. Kern, Mr. Perkins? Okay, any discussion? All in favor?
Aye.
Opposed? Carried. Next, we have communications. Luke, do you have anything? What?
We do have one communication, and then we have one video for citizen participation. So the communication is an email was received from David Duff of Hammond, encouraging legislators to appropriate the funding necessary for DANK to provide a study of broadband needs in the county. And that's all I have for communications.
Okay, thank you, Kelly.
Mr. Chair,
Yes,
since there is not listed a COVID-19 update, Dr. McGuire and Dr. Williams are available at this time during communications to provide that update.
okay. Dr. Williams, would you like to go first, or would you like to have Dr. McGuire go first?
Dr. McGuire.
Okay, go ahead, Dr. McGuire. Ladies first.
Good evening, everyone. I'm just going to share my screen. Oh, it says I don't have the ability to do so. I don't know if that can be changed.
Go ahead.
Go ahead,
Okay.
go ahead.
Thank you.
Go ahead.
Okay, can you see my slides?
Yes, yes.
Great. So just for where we are currently, we had 33 cases that were reported for this day. We currently have 8685 as the number of cases since we started back in March. Currently, there are 25 individuals in the hospital. We currently have just over 700 people who are active in isolation, and just over 1,900 people have been through the isolation. Since March, we have had 46 deaths here in the county. Here's the graph that I show that really just takes you through each case or each day and how many cases we have just on a daily basis. And so you can see the steep increase that we continue to have through the winter months. If I show on a weekly basis, this shows increases and during the past week, that 7 days time. So we are seeing like a rise in the cases that could be, due to the holiday. And then just on a daily basis, what we're seeing as a load to do case investigation and contact tracing. So that really just does continue to increase. And in this past week, which is only 6 days, because as you know, we do a reporting from Wednesday to Tuesday, as that's the day that we started on, we saw just over 80 people as an average per day. In the last 2 weeks prior to this week, we saw just under like 50 people. So there's been a steep increase for the daily load that we do see. For those people who have been through the isolation and the quarantine process, like I mentioned, we have 730 who are either in the hospital or going through the isolation process. And we have just about the same who are in the active mandatory. So those are the individuals who have been in contact with those who have tested positive. We have closed out 12,500 people. So we have really seen quite a few people through this process. In the last week, New York State has taken over some of the guidelines of what the CDC has done with quarantine time. So we have moved in the last week from 14 days to 10 days if you are asymptomatic during that time. So if you have symptoms during the time that you are in the quarantine process, then you will still have to quarantine for that 14 days. One of the other things that we are not doing that the CDC has in its place is that if you do get tested, that negative test result will not change your quarantine status. So CDC does have a part that after the 7th day you can test, and New York State has not taken that on. It is still recommended that you do the quarantine and you monitor symptoms for that 14 days. So if you are someone who does qualify for 10 days for the formal process, you should still be monitoring yourself for the symptoms because the period that you could become positive is still that 14 days. We have changed all of the documentation just to reflect this change. And so one of the things that we're trying to get out to the community is what to do if you do live with someone who is tested positive, because you actually don't start your quarantine kind of period until your last exposure with the person who has tested positive. So if you live with someone who has tested positive and you can't separate from them, your date of last exposure is the date that they're done with the isolation process. So if isolation is 10 days, then the quarantine period, if you're living with that person, will be just twice that, because it will be 10 days during their isolation period. Then they end isolation and then your quarantine period starts. So then it's 10 days just for you. And that's if you show no symptoms. Some of the other things that we've been working quite hard on is just to bring the vaccine to the North Country. So in the last few weeks, we've been meeting with the hub, and that is a group of us in just like the 7 counties of the North Country region. CVPH is the hospital hub for the region, so they lead the meetings, and we share what we're working on and all of the things that come down from the state with regard to the prioritization of who gets the vaccination, who is going to be ordering vaccine, when vaccine is going to be coming, and how we should do that kind of distribution. So we do meet kind of regularly as a large group, and then go back and have things just to work on, and then we need to report in. A final plan to the state from the North Country Hub is due this Friday. So we're all working just to get that plan in as a combined plan for the region. We are starting to look at where we're going to hold those pod locations, or where we're going to do vaccination for the community at large. And so we are looking to split the county just into regions so we can reach everyone and pick sites that are going to be just accessible, just so that everyone can get the vaccine. So we're just working on that. We've done some site visits, and we're working to do the collaborations with the health systems, with the public health department, and then we're asking for volunteers to help make up those teams that we need with regard to just providing the vaccination, providing that monitoring post-vaccination, and then all of the administrative tasks that will need to take place at those sites. So just bringing those groups together so we can make teams, and so that we can offer the vaccination as much as we can. We do have to provide the vaccine to the priority groups. We are currently in the 3rd week, which is this week. And so the focus this week is still on what all of the hospital workers and healthcare, and that's been expanded to outpatient, and then just anyone who has like a direct contact, and frontline workers, those who are doing vaccination and things like that. For next week, it is expected that home care workers, hospice workers, and then all of the skilled nursing facility staff that weren't tested in that 1st or the 2nd week, that they will be tested, or they'll get the vaccine just as well. For the next phase, we are looking for the essential workers to get the vaccine, and for those who are 75 years and older. So we are waiting to hear when that happens. And it is likely that our department, the local health department, will start to receive vaccine for next week. So we have been working just really hard to get that all to kind of pull together and work with the hospital systems. As we have the vaccine coming, it is still really necessary that we follow all of the guidelines. We are really just increasing with the amount of cases. Sometimes it's in our households, it's in our family. So it's just really important to make sure that we are wearing a mask, that we do practice social distancing. We continue to wash our hands or use hand sanitizer. We do monitor our symptoms so we know how we feel on each day, so that if we should stay home, that's what we should do. And really just thinking about when we need to go out and where we need to go because the cases are just rising across the state and across the country. So at this time, that's what I have for my presentation, and I will stop sharing so Dr. Williams can do his. Thank you.
Thanks, Dana, and good evening to everyone. So I wanted to just start with a national summary. Since this is a pandemic and what happens in the rest of the country certainly impacts us, I like to start at the national, then the regional, and then talk about what's happening locally. If you look nationally, we now have more than 20 million cases. We have more than 350,000 deaths. We're averaging approximately 2,500 deaths per day. And we have more than 120,000 people currently hospitalized. And the national average is 57 average daily cases per 100,000. So if you look at what Dana had said about us locally, we're actually higher than the national average. As far as the 7-county regional trends, so if you look at new cases per 100,000, the region is at 53.6. And if you look at percent positive, we're at 8.8%. Sorry about that. I did want to just give a quick update on testing. You know, it's an important part of controlling the pandemic. And I think it's important for us to understand how we're doing as a county. So this is the St. Lawrence County daily testing trends looking at the past week. And what you can see is there's some variability. Some days we test, you know, just over 350. There's some days where we've tested more than 1,000. Some of that are contributions from the nursing homes. But again, it's testing that's happening across the county. If you look at how we compare as a county to a couple of the contiguous counties, Jefferson County, with a fairly similar population, has tested 78,000, a little bit over 78,000. Franklin County is about 48,000. And St. Lawrence County has tested 144,000 plus. So I just bring this up as sort of an example as we're looking at what's going to happen with our vaccination program, that this was an example of the county and the healthcare systems really cooperating, and the county, you know, doing an excellent job with something important like testing. I think we're going to do the same thing with vaccination. As far as the update on vaccines, we all know that the Pfizer or BioNTech has been available first, then the Moderna vaccine. The Pfizer is the one that has the intense cold storage requirement. The Moderna needs to be frozen, but is able to be at warmer temperatures for longer. The next vaccine that should be coming in the next few months, I would say, is likely going to be the AstraZeneca one. There are 2 other vaccines that are also candidates, one by Johnson & Johnson and another one, but Britain has approved the AstraZeneca one, so I have a feeling this may end up being the next one. The interesting thing about this is this can be stored at just regular refrigerator temperatures. And so that'll give some flexibility in terms of how this is administered and how it's distributed throughout the community. I did want to take a little time to answer what I consider to be sort of frequently asked questions about the vaccine. So I'm going to go through them, and I certainly am able to talk to people offline or at a later date if they have specific questions, but these are kind of reflective of some of the questions that I've heard from patients or in the community. So a big question is, you know, will the vaccine make me sick? And, you know, what we've seen with the studies that have included like 70,000 people is that there have not been any serious side effects related to the vaccines that have been reported. Much like influenza vaccination, people do get some people get a sore arm, some people get fatigue, headache, and maybe a low-grade fever. These are symptoms that, if people get them, tend to last for 1 or 2 days after the injection, and then they go away. An important question is about allergic reactions, and there have been some reports of severe allergic reactions to the vaccine. They've been extremely rare. They were reported basically when the vaccine was first administered. The reason that we have people monitored after vaccination is to look for this reaction. And if people get the reaction, it's treated with an EpiPen and some other medications. And it's really much like a bee allergy. Which brings the question, if one has allergies, can you get the vaccine? And for the majority of people, the answer is yes. So the CDC and New York State Department of Health feel that people can get the vaccine as long as they don't have an allergy to the injection form of the ingredients that are in the vaccine. And because this can be a little complicated for people, I would encourage people to speak with their medical provider just to get their opinion about it. But the majority of people, even with allergies, can safely receive the vaccine. Another question that comes up is, are the vaccines safe for children and pregnant women? And right now, there are a number of studies that are going on to really help clarify this. Nobody was included, no pregnant individuals were intentionally included in the phase 3 clinical trials, and children were not included in the initial studies. Both groups are now being studied. The current recommendation, though, is if someone is pregnant and they're in a priority group, they should be given the option of vaccination, and it's something that they should discuss with their provider. Another question that's come up, and this is more of a social media thing, is does the vaccine cause infertility? There's no evidence to support this, and I would say this is most likely an example of sort of internet disinformation. If you read the trials, it's notable that 23 individuals, I believe in the Pfizer vaccine trial, became pregnant during the trial. And in fact, more people who received the vaccine became pregnant compared to the people who did not receive the vaccine. So there's no evidence to support the idea that it causes infertility. And in fact, the limited evidence that's available, suggests that it certainly doesn't. Another question that's come up is, does the vaccine contain animal-based ingredients? This is important for some people. And the answer is no. Neither vaccine uses any animal ingredients. They're cell-free. They don't have human or animal products. I think there's some question about fetal matter or something like that. They have nothing to do with that. They also, interestingly, don't have adjuvants or preservatives. And some of this has to do with their cold storage requirements and things like that. But unlike some other vaccines, they don't have adjuvants and they don't have preservatives. So for some people who have questions about vaccines for that reason, that's actually not an issue with these two vaccines. The other question is, if you're going to get the vaccine, do you need to get a negative test beforehand? And that's specifically recommended against. So you don't need any testing before you get the COVID vaccine. And then kind of on a related note is, if you've already had COVID and recovered, do you still need to get vaccinated? And the recommendation is yes, people should still get vaccinated. The rationale for this is we don't know how long antibody protection is present after the natural infection. And we do know that people become reinfected. The other question is it safe to get a COVID vaccine if you have an underlying medical condition? And the answer is emphatically, yes, it's safe. And in fact, as the CDC guidance reflects, it is the people who have these chronic medical conditions that we're really hoping will get vaccinated. They seem to be the people who are at greatest risk for a poor outcome from the COVID infection. So we really want people, especially with lung disease, heart disease, diabetes, and obesity, to be vaccinated. That's the group that's at greatest risk from the infection, and we want to protect them the most. Is it better to have natural immunity to COVID-19 rather than immunity from a vaccine? And the current answer is no. Again, same issue with the short-term antibody protection. And the other thing I'll just remind folks is that, certainly a number of people get this illness and have mild symptoms, but there are enough people who get this infection and become severely ill. Some of them die, but some of them also have these long-term disabilities. So it's not a good idea to just try and get the infection so that you can become immune. And then if you get the vaccine, do you still need to wear a mask and socially distance? And the answer is, for right now, yes, you do. It really doesn't change any of the other public health guidance is, but I will put out there that this may change as more information is available about the long-term vaccine, efficacy, and also as more and more people become vaccinated. Obviously, the goal is for people to return back to normal, but it's going to take quite a bit of time. Important question, is the vaccine free? And the answer is yes, the vaccine are going to be available at no cost. So that's certainly important. And then will people be required to get a vaccine? And I think this is something on a lot of people's mind. And the answer is no, it will not be required. New York State has made a decision not to mandate COVID-19 vaccination. So I know that was a lot of FAQs, but I thought it was important to cover some of them. I want to shift over to just a kind of a general summary about this. So we currently have the 2 vaccines available in the community. And I think the key points that I just want to underline, and these are things that Dana brought up, are it's a phased distribution. I think everyone understands this now. It's not just that the vaccine is available in pharmacies and hospitals and public health. It's going to be phased. The phases and the priorities are determined by both sort of the CDC provides guidance, New York State is the one who directs it, and St. Lawrence County is basically just implementing the priority lists that have been established by these other entities. I also want to underscore that this is going to be a partnership between the county, the hospitals, the federally qualified healthcare center, and pharmacies. So much like testing, it's something that the county is very much going to be involved with and help direct, but it's going to be a collaborative effort between these different entities. At the end of the day, the goal is to have a safe vaccination plan, an efficient vaccination plan. So we want to make sure that one of the measures that the governor talked about today is when they've distributed these vaccines to hospitals, what % of those vaccines have been administered? We want to be at the top of that list as the hospital systems, but also as a county. We want to make it accessible, right? This is a very rural county. And so when we're thinking about where the points of distribution are for vaccination, Dana and Ruth and I are really making sure that it's going to be representative geographically so that people in the more rural parts of our community will have access. And then it's supposed to be equitable. So communication, I think at the end of the day, is key. And I don't think communication has been as good as we'd like it to be on a national level, on a state level. And I think on a county level, we can continue to improve and there's real effort to make that happen so that people don't feel like they're in the dark. It should be a transparent process. I did want to switch over to a kind of concerning aspect of the pandemic. And I did talk about this a couple of weeks ago, but I think it's worth updating. So there is this United Kingdom strain of the COVID virus, and it's called the B117 variant. It was first detected in the United Kingdom on December 14th, but when they look back, they think it's actually been there since September. There's some other very similar strains that have also been found in Denmark and maybe South Africa. So it wasn't just UK, but that's what it's called. There's 17 mutations that have been identified, and they've changed the spike protein. And the spike protein is like the real main characteristic spike that's on the virus. That's why it's called the coronavirus. It's also the protein that allows the virus to attach to the receptors on human cells that then sort of creates this cascade of infection and difficulty. There's more and more information coming out about whether this is really a problem or not, but some of the initial information suggests that it's about 50 to 75% more transmissible compared to the more common version of COVID-19. So when people talk about the R value, which means the reproductive rate, so if one person is infected, how many people are they likely to infect? This has a higher R value, and that's a problem. The other concern is there's some early suggestion that it may cause more infections and more symptoms in younger patients. So this pandemic has been characterized by, our more senior people in the communities being impacted. There's some indication that this variant does affect younger people and that it may cause more symptoms in those younger people. So that's obviously concerning. It's pretty clearly a contributing factor to a rapid increase that we've seen it started in southeastern England, but now it's throughout England. And in fact, in the papers today, Boris Johnson, much to his chagrin, is basically shutting down the United Kingdom, really probably in response to what's happened because of this variant. The challenge is that, as we've seen with this virus, when the mutation occurs, it doesn't just stay in one country. And there's documentation that this variant is in multiple countries and in multiple states in the US. So this raises a number of questions. One question is New York State and the CDC monitoring for the presence of this strain of the virus? And the answer is yes. So this virus is being, very carefully monitored throughout the country, including New York State. An important question is, if this virus is mutated, do the tests that we currently use, are they able to detect this virus? And the answer seems to be pretty clearly yes for the PCR tests, yes for the molecular tests. For the antigen tests, for some of them, it definitely will. For some of the antigen tests, which are looking for specific proteins, if an antigen test is looking specifically for the spike protein, there's some concern that they may occasionally miss this virus. So this will be important. A big question, since we just talked about vaccines, is will this impact the effectiveness of vaccines? The preliminary understanding is no. So even though there's a change in the spike protein is made up of tons of amino acids, and those are largely unchanged. But until we have more data, I don't think we can give a conclusive answer, but the preliminary answer is that the vaccine should still work just as well. Important question is it more deadly? And again, we don't think it's more deadly, but because it's more contagious, more people get it and more people die. So it doesn't have a higher case fatality rate, it just causes more cases. At the end of the day, it just reinforces the importance of public health measures and our vaccination campaign that we're embarking upon. The last slide I put just at the last moment is a big question that I get throughout the day, that Department of Health gets throughout the day, is when, people ask, when will I be eligible for the vaccine? And New York State at like 5 p.m. put up a new part of their website, and I can share the link later, but it has this little thing, and I put a red arrow next to it, says check eligibility. And you can go to that site and you can put in your demographics and your occupation, and it will tell you whether you're eligible for the vaccine or not. I tested it, and I can tell you that for many people, it will just simply say you're not eligible, but you can ask it to send you an email about when you are eligible or a text message. So if people are interested, they might want to go to the site. On a county level, we're also going to work on these kinds of communications. And again, this is just part of the importance of being transparent and letting people know when they might be eligible. So that's my presentation, and Dana and I are certainly would welcome questions.
Jim Reagan, go ahead.
Dr. Williams, thank you very much for all the hard work you've done on behalf of the people of the county, and Dana as well. One of the concerns I hear out in the community is the fear that there's large quantities of vaccines that have been sent to the county and are sitting on a shelf instead of being distributed. How are things going in terms of administering the vaccine and keeping up with distributing the vaccine as supplies arrive?
So right now, the vaccine that's been delivered in our county has been delivered to the hospitals and the pharmacies that are responsible for vaccinating the nursing homes and the staff that are there. And what I'll tell you from the hospital perspective is that we've made it our singular priority to vaccinate people, as many people as quickly as we can. So there's a whole team of people certainly at St. Lawrence Health System, but also at Claxton and Clifton Fine, who have been doing everything they can to vaccinate all the people in the priority group that's eligible. And again, I want to emphasize that it's important for people to realize that when we get the vaccine delivered, it literally has like a receipt in it, which they call the allotment. And so they do dictate to the recipient, the hospital. They say, you will give 20 vaccines to employees from River Hospital who are in priority 1A. And as much information or as much of an emphasis as there is about finding people for giving it to the wrong people, there's a real emphasis on sticking to these priority groups. So that was a long way of saying, as soon as we get the vaccine, we make every effort to administer it to people. And we don't want that vaccine sitting in the freezers for a second more than it has to. And it's not. I mean, I don't want to put out, specific numbers that are misleading, but I know that Health System and Claxton Hepburn and Clifton Fine, we've done more than several thousand vaccines already. And we're working through those priority groups, and we're reaching out to EMS. We're reaching out to Office of Mental Health. We're reaching out to all the people who fit in those categories. And looking ahead, like hospice, for instance, is able to be vaccinated next week. There's already been outreach to hospice to get them to sign up in the CEM system. As soon as they're eligible, they're going to get their vaccines.
Thank you very much. I think people who read about what's been happening in some of the major cities, and they just sort of assume the same problems are facing here. But I think you and public health and the hospital systems, both Claxton and CPH, have worked hand in hand to make this as efficient as possible. And I think that all the people of the county are grateful. And I think as long as everyone understands we have to wait our turn, and you guys have to wait for supplies to arrive, we'll get through this together.
Absolutely.
Legislator Haggard.
Thank you, Mr. Chairman. I would concur with Mr. Reagan's remarks about the job that both Doctors William and McGuire have done. My concern is with the current administration in Washington, D.C. and their inability to get the numbers promised out to states and therefore to regions. I've read that it's going to take between 7 to 10 years at the rate we're going. Are we receiving what we expected because we live in a progressive state, or are we being affected by the inability in Washington to get their act together?
Well, I'm just going to say that we will vaccinate every vaccine that arrives in St. Lawrence County, whether it arrives to the county directly or to the hospitals or to the FQHC. What we'll do is what we can control, which is to get it to the right people just as quick as we can.
And the public department has not yet received its first set of doses. We're just required to do estimates across our county in certain populations. So expecting to receive but that will be shared with what the hospitals, what the FQHCs get. It will be a combined effort.
Thank you both for your answers, and I also want to thank you for being so communicative individually. Thank you.
Legislator Sherman-Alley.
Thank you, Mr. Chairman. Goodness, I can't get my finger to unmute tonight. Thank you both, Dr. McGuire and Dr. Williams, for your presentation, as well as for your continued efforts and your team's efforts to keep us informed and protected and safe. I have a few questions. First one being the frequently asked questions portion of your presentation, Dr. Williams, I found to be very, very beneficial. And many of the questions on there were things that constituents have asked me. is that information able to be posted so we can refer people to either our public health, the county website, or to the Facebook page with those frequently asked questions on it?
Absolutely. And Dana and I and Ruth have discussed, I think with the social media presence for the county, everyone's going to work to make that as good as it can be. And I think having a little link to the FAQs will be part of what we will plan to do with the vaccine portion of the site. Right, Dana?
Okay, thank you. Another question I have is, so I noticed when we looked at the phases that were on the presentation, a lot of it, a good deal of it.
Motion detected at the front door.
Sorry, Alexa. A great deal of it spoke to our essential workers, our frontline workers. But I did notice that listed in there, I did not see our higher risk of complications due to the underlying health conditions, such as the diabetes or heart conditions, lung conditions. Where will they be in the phases, I should say?
Dr. Williams, you can correct me if I'm wrong, but I believe they're starting in the next phase. It's going to be those who are 75 years and older, those with high risk.
Okay, great. And it seems that there's a lot of, it's not a fine science as to when vaccinations will be deployed to different areas. So we are kind of all in just queue waiting. Do we have an estimate number of vaccinations that are in queue to come? And I know that anybody that's been vaccinated already will have to have a second follow-up dose in either 21 or 28 days, I believe it is. So I know that they will be prioritized to getting those next vaccinations that come in. Do we have an estimate or any type of a timeline to be expecting vaccines? Again, I'm getting a lot of questions from constituents about when will I be eligible? Is this going to happen this year? Is it going to happen next year? Do we have any idea, or is it really just out of our hands and we're just waiting?
I think, what the state is doing by putting these weeks together is they're sort of anticipating things almost on a week. They're predicting things almost on a weekly basis. So the document that Dana and I most recently received was, who's supposed to be vaccinated weeks 1 through 5. They don't include a week 6. So I think the state is working with the federal government, who are working with Pfizer and Moderna to get the delivery of the vaccines. But I think there are enough unknowns that we don't have our weekly planner is just that. It's a weekly planner in terms of any kind of firm dates. We don't have a monthly planner. And when you look at the literature, I see some predictions of like, oh, we're going to get to priority level 5 in August. And then I see other people saying it's going to be April. So I think there's just a lot of unknowns. And keep in mind, I think one of the biggest unknowns is some of these other vaccines that are going to become available. So there's some other RNA vaccines, there's some other more stable viral vaccines that are going to become available. And that's going to change this whole approach, or it's going to modify the approach. And it's going to make it easier, for instance, for doctors' offices to have the vaccine, just like we have a lot of other vaccines. Once those more stable, more easily stored vaccines are available, that'll change the whole metric, as the whole matrix as well.
Great, thank you very much.
Go ahead, Mr. Burke.
Dr. Williams, I heard on the national news, they said that New York State's distribution was 25 to 50% in that range, and that there were only 4 states that were above 50%. Any insight on what's causing the problems with distribution? And I have a couple of other questions too, if you don't mind.
And with those percentages, do you mean like the governor talked about that 47% of delivered vaccine has been administered? That percentage?
Well, if I understood it correctly, it sounded more like the distribution, not the administration.
Okay. Well, there's a few different things. I mean, I think the whole the whole process has just been a challenge. I think the communication between the federal government and the state government, I think, has been a challenge. I think the communication between the state government and the counties to some extent has been a challenge. I think the cold storage has been probably technically the biggest issue. I also think that the priority lists create a certain obstacle for people in the sense of, right now, if we could just vaccinate everybody who wanted to come to the hospital, we could vaccinate a lot larger numbers of people. But because we're trying to be very careful and sort of stay in our lane in terms of what part of priority 1A we're in, that slows the process down a little bit. I'll be honest with you, my biggest concern was with the nursing homes and the assisted living. I think, we were all biting our nails, thinking, gosh, I can't wait until I hear that the nursing homes got their vaccine. I can't wait till the assisted living got their vaccine. So it's been imperfect. I think it will get better, but it's not going to be as fast as anyone wants it to be.
The other question I had was on transparency and the equitable part, and I'm wondering, from your presentation, it sounds like the county has oversight. It's a partnership with the hospitals, but it would appear that the county public health has oversight, assuring that the appropriate people in 1A or whatever the category currently is, the appropriate people are receiving the vaccine and not inappropriate people. Is that accurate?
Well, to be honest with you, with 1A, I mean, New York State Department of Health has representatives at the hospital watching us do the vaccination. And there's now a requirement that we check, IDs of people. So many hospitals are having people sign like a little affidavit that they are a frontline worker and so on and so forth. So people are taking this very, everyone's taking this very seriously. I think 1A has largely been in the hands of the hospitals. That's where the vaccine was delivered, and that's who's been mandated to administer it. I think as we get to 1B and 1C and the other phase, that's where the county will really step in and have much more specific involvement in the equity part of it. But I may not be answering your question, but I will just tell you, I've been part of this process. Everyone in the hospitals is being super careful to make sure that the right people are getting vaccinated. One of the tricky things is we also don't want to waste vaccine, and especially the Pfizer vaccine. When you open a vial of the vaccine, it has either 5 or 6 doses. And if you don't have a 6th person to administer the dose to, that's a problem. And so one of our challenges is really to line up all the right people to get vaccinated and not waste it. But people are being incredibly careful and checking IDs and verifying that people are getting the vaccine.
And just one more question, if I could, so that in the 1A group, it's direct care. For the most part, it doesn't include administrative staff and clerical staff. And do you have, when you get to that 6th dose or a dose that you need to administer or run the risk of wasting it, is there a preferred list ready for that?
There is, and we prefer the preferred list to just be the people who are in 1A in that week. Two things are worth noting. One is that every other day, if not every day, the New York State literally updates who's in 1A and in what part of 1A they're in. So the quote unquote rules 2 weeks ago are not the same rules as they are this week. I think it's gotten more and more granular. And the other thing to keep in mind, and I think sometimes people in the community may wonder, well, I know that person's like a clerical person. Why did they get vaccinated? We have clerical people who work in the hospital, who work in our airborne precautions unit, and they're critical and they're exposed. and they get vaccinated. So part of the equity in the system is also making sure that people in environmental services who clean the rooms, you might think, well, you're not a doctor, you're not a nurse, but they're right in there as vulnerable and maybe more vulnerable than everyone else. So part of the equity is actually to make sure that people who are clerical or who are environmental services, if they're exposed because they work in a hospital, they get vaccinated. And some people also have jobs where part of their job is clerical, and then part of their job is to go to the COVID unit. And we recognize that and make sure that they're protected through vaccination.
Well, again, certainly not accusing anybody of anything, but as it relates to transparency, and as we look at the burning need for nursing home residents to be vaccinated, it's just good to know that there's close attention being paid to who's supposed to receive it and who's not.
Absolutely.
Mr. Akers.
Thank you, Mr. Chairman. Well, it is the new year, and I thought that we could avoid the vitriol that from the left and from the right, that interface. But Mrs. Haggard wants to talk about the federal government, which really we have the Trump administration to thank for Operation Warp Speed. This is just truly a miracle that the resources that were put into this that actually made this vaccine available to us within actually 9 months of actually having the COVID. Just in tonight's New York Times, which is the progressively regressive totalitarian communist rag of the North Country liberals, it states that New York, the one-time center of the pandemic, faces a growing crisis on Monday over lagging pace of coronavirus vaccinations as deaths continue to rise. Andrew Cuomo was under mounting pressure to overhaul the process. The small number of vaccine recipients is particularly striking in New York City, where approximately 110,000 people in a city of more than 8 million have received the first 2 doses necessarily to help prevent serious cases of the disease. This is about 1/4 of the total number of doses received by the city. 1/4. But somehow it's a federal problem. Governor Cuomo says he rejects any notion that this administration was at fault for not distributing more vaccines, asserting that the problem was a local issue. It's your damn fault there, Mrs. Haggard. You're the local issue. You're blocking this somehow, right? So it's a typical shifting of blame. I'd like to focus on the local level. I've been getting some calls, Dana, from constituents for someone that has been exposed to the COVID. It's not a point of order. It's not a point of order.
You must give a reason. Give a reason.
I am giving a reason. When Margaret posed her question, she posed it to we're in an update with our public health department. Margaret posed her question to the public health department. Mr. Akers is simply making a political statement and doing what he does best, political grandstanding. Please control the meeting.
So first of all, Mr. Chairman, this is not a point of order. Parliamentary procedure has not been, and I reserve my right to express my opinion, much like Mrs. Haggard. So the question I have for you, Dana, is from constituents, is what is the timeline for quarantining for an individual if they are exposed to a COVID person? Is it 5 minutes? Is it 10 minutes? Is it 2 hours?
So what do we consider a close contact? Is that what you're asking?
Well, so say someone's in a room like this, what would be the protocol? What is the CDC or what's the state? Does yours differentiate from the public health of St. Lawrence County? Does it differentiate from the state?
I don't believe so. So there's still 2 types of contact: close contact, which is within 6 feet of somebody who tests positive for more than 10 minutes. And that now can be on a cumulative basis. So it doesn't have to happen all at one time. We still do have the proximate contact, which doesn't come into play as often, but it's like in a school setting where you're in a classroom all day long. And so you may not be 6 feet, it may be for 7 hours. So it's more difficult to know, if you're going to have that exposure. So that's approximate contact. So you're further away, but you were exposed for a longer time.
So the rule of thumb then is if from the state and from St. Lawrence County Public Health is 10 minutes of accumulated time. Would that be correct?
Yes.
Okay, so this individual was told 5. The other thing that you mentioned tonight is CDC does allow for a negative test to change the quarantine status, and New York does not.
So CDC allows that after 7 days of quarantine, you can go and get tested, and that if that test is negative, you can be released from quarantine. We did not take that portion of what CDC does on for New York State.
When you said we, is that St. Lawrence County or is that New York State?
New York State.
New York State, okay. So then the other thing is, if you live with someone who has COVID, they have to quarantine or isolate for 10 days. And if you're not able to isolate for the 10 days, an individual living with them has to go an additional 10 days beyond the end of so that's actually 20 days. Would that be correct?
So we always start the quarantine process from the last day of exposure. So if I tested positive and I saw you today, the quarantine time would start today. But if I lived with you and I had to be in isolation and you couldn't totally separate from me, then you would be constantly exposed until I was out of isolation. The process in both times. Some people need to be excluded, they have symptoms after that 10-day period. But most times it's 10 days. So I would have isolation for that 10-day period, and then your quarantine time would start at that time. 10 days. Why it's a little bit longer.
Okay, Dana, we lost the audio on the end. I don't know if it's something on your end. We couldn't understand the last part of it.
Can you get closer to your mic, maybe?
Sure. So we define an exposure, or we define the start of a quarantine from the last date of your exposure. If you live with somebody and you cannot separate from them, the last date of your exposure from that person who is isolating in the same home is the last day of their isolation. And isolation in general is 10 days. So if you live with someone, they have to do the isolation process, and then your quarantine period starts because you've been exposed to them until they've kind of been released from isolation. Did you hear me okay?
Okay, go now.
Okay, I'm sorry. So are you notifying those individuals? Because most people are actually quarantining and then they're getting hit with a 30-day additional quarantine.
So we had a 30-day order, and that was on recommendation through the legal process. If somebody needs to be extended, that's why we did that. We actually took that away, and about 3 or 4 days after, we found that the state was reducing the quarantine time. So our orders and all of the welcome emails, all of that stuff has been updated to reflect that you will have a 10-day quarantine if you are symptom-free. If at any time during quarantine you have symptoms, you will have to quarantine for 14 days, just like we always used to do. And that if you live with a positive, your last day of exposure is when that person who tested positive is done with isolation, your quarantine starts. That by the time we talk to the person to start the isolation process, very seldomly do they have 10 days of isolation left. One, because it does take us a while just to get to them, but their isolation process starts either when they've been tested or when they started with symptoms. So that's very rarely on the day that we're talking to them. So it's already started a few days ago. So it could be up to 20 days, but oftentimes it's not that long.
So,
go ahead.
So it almost seems like not to have the COVID, but to be tested positive for COVID, you actually would only have 10 days. of actual quarantine.
If you
Versus someone who lived with you would be there, they would be there for the 10 days plus an additional 10 days. So it seems a little irrational that the person with COVID is free after 10 days, but yet the person living there has to do 20 days.
So Kevin, I'll just pitch in here that if you're looking at this as some sort of a legal, punitive thing, that's one thing.
No, I'm actually responding. This is what my constituent said to me today. I got a call today.
It's all based on the science related to the incubation period and how contagion works for the virus. So, and I wasn't joking about how you look at it, but I think if people understand the rationale for it, there's very good, epidemiology science that supports an understanding of how long it takes for the incubation period, which is frankly how you came up with 14 days, which is the, sort of the stricter, more maybe scientifically more appropriate duration. But I think in deference to the fact that 14 days is a long period for people to not be able to work, and in deference to the fact that you could end up in the previous system with 24 days, it was 10 days. And at 10 days, the majority of people, something like 97% of people, are not likely to become positive after 10 days of not having symptoms and testing negative on day 10. So there's a lot of science behind this.
That's what I also wanted to say. So the CDC still actually says that the 14-day time period is still the best because the incubation period is 14 days. But like Dr. Williams just said, they did want to reduce the time to hope that people would just complete the process, make it easier at the 10-day mark. But if you have symptoms, it's really important that you do carry that out until the 14th day.
Okay, so I'm glad that you changed the page. I requested that it be accessible on the county website. Right now it's in the public health website, and I think that Ruth and Dylan, we're working with them today. They're going to change that so that actually when people are looking at the map, that they'll be able to access that. The one final thing, that was my previous thing, was just an exercise I did with a constituent today, Dr. Williams. So I didn't understand it. It didn't seem right to me either, but I had a mother that called me in distress, and that she was contacted by someone from public health. And I don't think it was somebody that works for us, and must be, I understand that the state is helping us out. And they were informed that their child had been exposed on December 8th at the local school here. And when the mother replied that he wasn't in school that day, that he was actually didn't attend school until the 10th, and the woman said, well, I'll just change the date. Very cavalier. You could understand why she would be upset. And obviously didn't know what had to ask about the school. And just one other suggestion, a family of 5 has had 5 different people contact them, one contact person for each individual. Would it not be better for one individual to be positioned to represent that family?
So 2 things. On the family, yes. And from our department, we try to do that. We do have state contact tracers. And so I'm not sure why that's happening, and it might be in our department as well. Not all the time does a family have the same last name though too. So, but we can check on that. But when people have concerns like that or the date at the school, they should feel free to either call the department or write an email to the department and ask those questions, because we can work those out.
Thank you.
Ms. Haggard, you had a question?
I
Point
do
of
have.
order. Point of order. Go ahead. I'm just joking. Just joking.
Go ahead, Ms.
Honey. Dana, or Dr. McGuire, excuse me, I don't like to do that, but I feel like I know you pretty well. You've put out a request for volunteers, and when I think of volunteers, unfortunately, we're old and we're scared. Can this board offer, I certainly can't individually, can this board offer to pay temporary people to help you? Or do you feel like you're going to be able to get an adequate number of volunteers that you need to administer the vaccine?
So like I mentioned, it's not the public health department working on our phone. It's us are asking for volunteers, whether it's a medical volunteer or a non-medical. So you can help with traffic flow, you can do vaccinations, you can do monitoring, but we are working jointly. We do have the ability to ask pharmacies to assist us. So there'll be a group of us. So I think at this time, we will have enough people to provide vaccination, but I can keep you updated. I mean, as I mentioned, we are just starting to receive vaccination in our department, hopefully next week. But again, we don't know for sure until it gets here. So we don't know how it's all going to roll out yet, but we do want to get volunteers just in the books, because we want to make teams that can go to all 4 regions of the county and make sure that we can offer it in the same way just to all of the regions.
Thank you very much for your answer, and please keep us apprised of your progress. Thank you.
Go ahead, Mr. Burke.
A couple of times this past week, once when I was pumping gas, I witnessed a couple people going into the gas station without mask. I guess I'm just wondering, maybe it's been a while since we've talked about it, but what are the state requirements for mask wearing in public places?
I think it is required in public places. I see that Steve has one. Steve, if you wanted to add to that.
I didn't catch that, Dana.
I'm sorry. I think it is a requirement to wear a mask in the public, but I see that Steve Button just showed his camera and he might want to comment on that.
Okay.
Legislator Burke, it is, in fact, it's a twofold responsibility. There's the individual mandate that requires that individuals that are in public spaces that know they can't maintain social distance are required to wear a mask. The second mandate is actually a business or corporate mandate that is imposed upon vendors to require that those who actually visit their locations are required to wear masks as well. This past week, actually, the executive orders that are known as the New York on Pause, which are comprised of executive orders 202 through 202.21 and 202.28, and then there were subsequent executive orders that extended those. Those were extended to January 29th, and that's where that stands right now. So the mask wearing mandate, both individually and corporately, is in place and remains in place until January 29th.
Thanks, Steve.
You bet.
Any more questions for the doctors? Thank you very much, Dr. Williams and Dr. McGuire.
You're welcome.
This Dave Duff communication, is that going to be happening?
Citizen participation.
Citizen participation bill.
Okay, it'll be under citizen. Okay. All right, let's go on to citizen participation. Any citizen that wants to speak may do so. They have to step up to the speaker and state your name and your address before beginning your address. And the time limit's 5 minutes. Looks like there's no one here. Just step up to the speaker and state your name and your address before beginning your address. And the time limit's 5 minutes. Looks like there's no one here. Just step up to the speaker and state.
Bear with us a moment, please. We do have one video recording that Dylan is attempting to share. We saw that.
Yeah, it's just the justice over here.
Ryan.
It's just the word for justice. Okay.
My name is Eileen Raymond, and I live in New York.
Yeah, take it.
According to the executive order, the chief county executive shall call together the sheriff and stakeholders in the community to develop a plan for any improvements. Further, the plan shall be offered for public comment to all citizens. After consideration of such comments, the plan shall be presented to and ratified by the legislature. It appears to me that the requirements of this process have not been complied with. The 2 meetings in October only allowed time for the sheriff to talk about policies they have in place and the major functions of the department. There was little notice of these meetings. The opportunity for questions and comment by designated stakeholders was limited. Opportunity for general public to comment was even more limited. There was no indication that the few comments allowed were actually considered in any revision of the plan. The document indicates that there was some outreach to the college populations, but there is no indication that other citizens throughout the county were afforded any significant opportunities to give input into the process. There was no call for written comments, as would have been expected. I noticed that a number of the policies included in the plan addressed non-discrimination and fair and respectful treatment of residents. However, we know that these are issues best understood by hearing directly from affected groups and individuals in the community, and not solely by what an officer writes in a report. I wonder how the Sheriff's Department plans to get input to assure that implicit bias and other issues are not affecting the relationship of the public with the policing unit. What data has been and will be collected to monitor these interactions. As minimal as the October meetings were, the final public hearing in December was even less convincing that real collaboration had and will occur. The hearing was set for December 21st at 5:10 at the courthouse with limited notice and when many were busy with final holiday and travel preparations. Members of the university community were no longer in town. The plan presented was identical to the one circulated by the sheriff in October. No apparent amendments had been made based on the previous comment periods. Citizens who wished to comment had to come to the courthouse in person or submit their comments 48 hours earlier in writing or video. But these procedures are not easily found on the website, and the short notice made it unlikely that there would be any comments. Only 10 minutes was allocated for public comment on this important process. Then the full legislature convened immediately to take the final vote to approve the plan, even though this wasn't their normal meeting time. As a citizen, I have many questions. Was there collaboration with stakeholders from throughout the county? Surely the experiences and needs of our citizens in our villages and unincorporated areas of our towns are unique and should be considered in our public safety plan. How does the Sheriff's Department plan to collaborate in the future with other local governments and residents? How does the plan address the unique situation of villages like Canton with multiple police units? In Canton, we have the Canton PD, we have SUNY Canton Police, New York State Police, and the County Sheriff. How do we assure that there is a coordinated and consistent policing presence throughout the county? How does the plan assure an effective, efficient interface between the Sheriff's Department and other public safety services such as fire, mental health, and campus security units? What processes are planned in the future to allow residents to bring areas of concern about public safety to the attention of the sheriff or other responsible parties? Since the final submission to the governor is not due until April 1, I have to ask, what was the urgency to get the vote completed 4 days before Christmas? Why couldn't we take the time to give all residents a real opportunity to respond? With these and probably many other concerns on the table, I would hope that the legislature would find a way to continue this conversation on this important topic. Take the time to do this right.
Thank you very much for your comments. other citizen participation? There being none, we'll go on to presentation of resolutions. Mr. Akers.
Mr. Chairman, I offer a resolution for adoption of the rules of procedure. I move this resolution.
Is there a second? Ms. Kern? Mr. Perkins? Okay. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers? Wait a minute.
For you, Mr. Sheridan,
I may have,
Mr. Forsyth.
Mr. Forsyth will do that for me. Thank you.
Thank you, Mr. Chair. I have a resolution authorizing the chair to sign an intergovernmental personnel act agreement with the Centers for Disease Control and Prevention. Move for its adoption.
Seconded by Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Forsyth?
Mr. Chair, I have a resolution offering acceptance of additional stop DWI crackdown funds from the state of New York Governor's Traffic Safety Committee, and modifying the 2021 budget for community services. Move for its adoption.
Seconded by Ms. Kern and Mr. Larry Denisha. And that's it. Okay, any discussion? All in favor? Roll call. Okay, roll call vote.
Reagan,
Yes.
Forsyth,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Bianco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Resolution carried. Mr. Forsyth.
Mr. Chair, I have a resolution modifying the 2020 budget for social services for foster care and adoption services, and move for its adoption.
Seconded by Ms. Kern. Any discussion? We're gonna need a roll call on this, I believe. Go ahead with the roll call.
Forsyth,
Yes. Yes.
Lightfoot,
Yes. Sorry about that.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Bianco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
Resolution carried. Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution authorizing the chair to sign a contract with the New York State Department of Transportation for the purchase of buses and modifying the 2021 budget for the planning office and move its adoption.
Seconded by Ms. Curran and Mr. Smithers and Mr. Forsythe. Any discussion? We're gonna need a roll call on this. It's modifying, I believe. No? No, I think we don't need a roll call. All in favor?
No, there's roll call. There's roll call.
There is?
Yeah.
Authorization. Oh, let's do the,
Lightfoot,
Yes.
Sheridan,
yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
15 yes.
Carried. Resolution, Mr. Denisha.
Thank you, Mr. Chairman. I offer a resolution authorizing the chair to sign a maintenance contract with Business Electronics for voice recorders located at the backup 911 PSAP in Messina and move for its adoption.
Seconded by Mr. Forsythe, seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Opposed? Carried. Mr. Denisha.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the office of the county clerk for overtime costs for the Department of Motor Vehicles. Move for its adoption.
Seconded by Ms. Kern and Mr. Perkins. Discussion? We're gonna have a roll call on this one.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
15 yes.
Resolution carries. Mr. Denisha.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with trusted employees for background screening and move for its adoption.
Seconded by Mr. Perkins and Mr. Forsythe and Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Chairman Sheridan, I offer a resolution approving supplemental agreement number 3 with Barton and Judas DPC for additional construction inspection CI services for St. Lawrence County Bridge Preservation Project. Bids number 3340, 850, 3341, 310, 3341, 710, and 3341, 720, and also PIN number 7753, 78. I move this resolution.
Second by Mr. Forsythe and Mr. Perkins. And anybody on the screen? No? Any discussion? Go ahead, Mr. Perkins.
Thank you, Mr. Chairman. I'll be abstaining due to my employment.
So noted. Any other discussion? All in favor?
Aye.
Opposed? Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution approving supplemental agreement number 2 with Barton and Judas DPC for construction CI services for Depot Street over the Deer River project. Bid number 322-0850, PIN number 775386. I move this resolution.
Seconded by Ms. Kern. Any discussion? All in favor?
Aye.
Anyone opposed? No one opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for correcting and refunding erroneous taxes. I move this resolution.
Seconded by Mr. Forsythe and Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for the authorization of petty cash accounts and departmental cash drawers. I move this resolution.
Seconded by Ms. Kern. Mr. Perkins seconds as well. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Go ahead, Mr. Akers.
Mr. Chairman, I offer a resolution authorizing blanket bond in lieu of individual sureties for county officials and employees. I move this resolution.
Seconded by Mr. Forsythe and Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for bank depositories and investment of county funds policy. I move this resolution.
Seconded by Ms. Kern. And any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 WIOLA budget for the temporary assistance for needy families, the TANF. I move this resolution.
Seconded by Ms. Kern. Any discussion? Mr. Kern.
Sorry, just a quick question, Kevin. WIOLA was supposed to have been cut or had 20% of the budget that was going to be sort of like set aside due to the changes in funding of the state. Is it still affected, and are these the numbers with it affected?
To my knowledge, these are the numbers that are presented in this resolution as to be accurate.
Thank you, sir.
Any other discussion? I think we're going to need a roll call vote on this one as well.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
15 yes.
Resolution carried. Mr. Akers.
Mr. Chairman, I offer a resolution committing to honoring the current distribution formula of sales and compensating use tax to the towns and villages by St. Lawrence County. I move this resolution.
Seconded by Ms. Kern and Mr. Larry Denisha. And anyone else? Ms. Fiacco, and also, let me get glasses on the screen. Tony Arkwood, Mr. Burke, Ms. Terminelli. Okay, any discussion? Go ahead, Ms. Hagerty.
I think this is an excellent resolution. I understand that it goes to 2030. Maybe some of us won't be left on the earth at that time. And some of us may not be in this chamber at that time. What I do wish is that we abide by this commitment that we've made. People don't change their minds at the last minute, given pressure from other constituencies that may have an opinion about this. And I hope that we live up to our obligation that we're committing to tonight. Thank you.
Any further discussion? All in favor?
Aye.
Opposed? Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution amending resolution number 27-2020 for newspaper designation rotation schedule. I move this resolution.
Second by Mr. Forsythe and Mr. Jim Reagan and Ms. Kern, but we have an amendment we've got to do on this one, and I'll bring it to your attention. We're going to cross off Courier Observer on the bottom where it has the dates listed there from 2021 to 2025. And in its place, instead of Courier Observer, put North Country This Week. And that will be moved from the top.
If I could clarify.
What's that?
If I could clarify.
Go ahead.
So this resolution, as you'll recall, was amended at committee to reintroduce North Country This Week and then also move them to this year. What that means is with the accumulation of 4 options, we would start the cycle again. So it's not to take away from the Courier Observer in any way, it's just to start the cycle again. So North Country This Week will continue this year, but then when we get to 24, you'll see we've completed the cycle as it is now, and then we would start again with North Country This Week. I hope that's helpful.
Is there someone who would amend that to make that resolution read that way? Okay, Mr. Akers and Mr. Forsythe may make the amendment. All in favor of the amendment?
Aye.
Anyone opposed? Carried. Now, the original resolution. All in favor of the original resolution as amended?
Aye.
Anyone opposed? Carried.
Thank you.
Mr. Akers.
Mr. Chairman, I offer a resolution for newspaper designation. I move this resolution.
Seconded by Ms. Kern. And any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign contracts. I move this resolution.
Seconded by Mr. Forsythe and Ms. Kern. Any discussion? There be no discussion. All in favor?
Aye.
Opposed? Carried. Mr. Forsythe. Authorizing filling of vacancies, page 38.
All right. Mr. Chair, I have a resolution authorizing the filling of vacancies. Move for its adoption.
Is there a second? Ms. Kern, Mr. Larry Denisha, and there's your discussion. No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign documents necessary to facilitate COVID-19 vaccination distribution in St. Lawrence County and move for its adoption.
Seconded by Mr. Denisha and Ms. Kern and Harry Smithers, Legislator Smithers, Governor. Discussion?
Margaret Haggard, too. That's for him.
Somebody else? Okay, I missed Ms. Haggard.
I
You
was
had
just,
that
I was just,
seconded? I'm
yes,
sorry, I missed it. Seconded it. I got you.
thank you.
Ms. Haggard. Yeah. Okay, let's go with discussion. No discussion. It's modifying, so we're going to do a roll call.
That's the next one,
No,
Bill.
next one.
Oh, excuse me. All in favor?
Aye.
Opposed? Carried. Next one. Go ahead. Mr. Lightfoot. Go ahead, Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the county administrator's office for costs associated with court-ordered services at New York State-operated inpatient mental hygiene facilities and move for its adoption.
Second by Ms. Kern. Now any discussion? Mr. Akers, go ahead.
Ruth, could you give us, for the year, how much money we have spent in that function approximately? I think this is the second time we've added additional funds.
This is the second resolution, and I believe without knowing what November and December will include, the total spend, I can't pull it right up in front of me, I can get it for you. I believe we're at 468,000, but I'll confirm that for you. And at most, throughout this year, cumulatively, most of the time there are 2 individuals. I believe there was 1 month where there were 3. We are currently paying for 2.
Okay, so it looks like in the latter part of the resolution, we've spent in the first 6 payments.
Oh, yes, there it is.
537,000, then 118, so that's 650, and then additional 3, so it'll be over $1 million then, or approximately.
You know, November and December, if either person is released, that may decrease, but we'll be very close to $1 million.
So this is $1 million spent on 2 individuals primarily.
Cumulatively, yes.
Okay, thank you.
Any further discussion, questions? This one we'll have a roll call on.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes,
Hiyako,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Kern,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
15 yes.
Carried. County Administrator's Report?
Yes.
Do you have anything?
A few items to update you on this evening. For the county's purposes, the COVID-19 update, NISAC hosted a call of all county leaders, a combination of county executives, county administrator, manager types, as well as public health officials on December 30th. And Dr. Zucker, Commissioner of Public Health for the state, presented. They're pushing the hashtag Vaccinate New York, emphasizing information to be shared out to educate the public on the main three efforts that they're making with regard to the vaccine, that it's safe, that it's effective, and that it's equitable. So those slides we'll put up on Google Drive so you can take a look at those as well. I think important information can be shared with folks who may have reservations. Also, I wanted to make you aware, as I've mentioned to you in communications, that I am pushing for as many county employees to be considered essential and or tiered so that they can have access to the vaccine as soon as possible. Certainly, you heard Dr. McGuire tonight speak to the public health department employees, and I think as we move towards the vaccination component of things, it will be important to make sure that as many can and will be helping out have the opportunity to be vaccinated. We have had an additional positive in the correctional facility, as well as an additional positive in our buildings and grounds department. We did see the DMV in Ogdensburg reopen today, as well as the civil office of the Sheriff's Department at their physical locations. The services continue to be available, and that will be maintained for as long as we can manage that. The reason, as you may recall, that the DMV office in Ogdensburg was closed was everyone there, including the isolation for the positive, was in quarantine. So that made it very difficult for us to staff that location. But they reopened today. We also have had deep cleaning and disinfecting of human services as well as social services yesterday. I have 4 transfer of funds to report out to you pursuant to local law C of the year 2011. The first one is for solid waste, and this is a transfer of $5,000 between building and property maintenance accounts in units of solid waste. And this was for the Messina Transfer Station for a one-time building improvement. In looking at the expenses, this one purchase is what set them over. You may recall there were efforts to improve their apprentice at that location for compaction reasons. The second one is a $3,000 transfer in the county attorney's office. And this is due to an increase due to an arbitration this past year, which increased that overall budget. The next one is for $1 for social services in telephone accounts. And this is required. I would not bring these to you if they were not, but it was to balance the account so that they could close the year. And the last one was for the probation department, and that is a transfer of $750 associated with the modifications of the updated lease that you'll recall we signed, or the chair's been authorized to sign for the Governor satellite offices. Next week, just as an update, operations and services will be held together, as we'll recognize on the 18th, the Martin Luther King Jr. holiday, and finance will be held on the 25th. Also, just to give you an update, the bank reconciliation for October has been posted to Google Drive, and you'll find in your email, if you haven't already, an update on our sales tax performance, closing out December with 1 payment remaining. Also wanted to let you know that this week, you'll remember last month I reported to you on a Moody's bond review. This month, or this Wednesday, we'll be meeting with Standard & Poor's to do a similar bond review and await their results probably in a month's time. I'll keep you posted on that outcome. Also, vacancy review committee is scheduled for 1:30 for tomorrow. There are 9 positions to be considered from 5 departments. And currently, and I think it's important, as I mentioned to you last month, a total of the positions temporary in nature or filled by probation, probationary period not being fulfilled, or the highway contingent all the way through down to their base position, to give you an update on how many positions are currently vacant. And for the county right now, that is 68 positions, including those 9 that are vacant at this time of our 808 positions, or approximately 9%. This Thursday at 11, we'll meet with the Highway Committee for the capital project for the Highway Department discussion. Zoom invitation, I believe, has already been sent. Just to keep in mind, we want to maintain a level below a majority of the board, so that allows 7 to attend. There are 3 legislators who already serve on the committee. So if you are interested, I believe Legislator Akers mentioned an interest in attending, let the front office know, and we'll make sure that you have that invitation to participate. And if in fact there are folks that are interested that exceed that amount, we can leave some in the waiting room, and if some want to participate in some of the meeting, we're just mindful of staying below the minimum of 7. Also wanted to request that the Financial Stability and/or the Audit Committee, by name, convene in January to discuss the goals for 2021. And then on a more somber note, I just wanted to mention to the board in open session that over the Christmas holiday, the county is in mourning over losing 2 of our very best. One was a long tenured employee in social services, and one was a long tenured employee in the Office for the Aging. So we'll send our collective sympathies to their families and think of a way to honor their dedicated service for these members of the departments. They will be missed for years to come. And lastly, I just wanted to read to you also a thank you note from Mrs. Paquin following the honoring of her late husband at our December meeting. Thank you so much for the lovely proclamation, flowers, and kind words about our husband and father, Daryl. He served on the board at a time that had some very contentious and controversial issues to be solved. He worked hard at understanding the issues and always doing what he felt was in the best interest of the people he represented. We are so proud of the work he did and the decisions he made. It was wonderful to see him remembered for that. Again, we, his family, thank you. Sincerely, Julie Paquin and family. That's it, unless there's questions.
Any questions of Ruth? Go ahead, Mr. Akers.
Ruth, our drive-through in the DMV is still not open, is that correct?
That is correct.
So what matters or what efforts are we taking to get that open?
We are not permitted to at this time. If the board would like other measures taken, we can certainly look at that.
It seems that, and I mentioned this in committee, that if you can go through a drive-through, get a cup of coffee, or a hamburger or whatever, that we can certainly hand papers to our dedicated clerks. I think that we need to take further action. I mean, it's been 9 months, 10 months. That's revenue that we're missing out. And not only that, I think it's safer. So safer rather than people even actually coming into the building and dropping off their envelopes in the box. So I don't know what efforts need to be taking place, but I think we need to try. And just because we've been told no, I think that we need to redouble our efforts and see if we can get this thing open for the safety, for the revenue from our people and the service.
I would be happy to revisit that issue at the control room conversation. I believe it's scheduled for tomorrow, and find out if there's any consideration for those. I know the last I understood there were 2 in the entire state, so I would think consideration could be given to the circumstances around that. Okay. And I'll talk with the county clerk as well.
I appreciate that.
I know that the county clerk, last time we had a meeting with her, suggested that she was going to have a meeting with Assemblyman Walznick over that issue. And that was supposed to have happened a week or 2 ago.
I can follow up.
Yeah. Any further questions? Ruth? No further questions. Let's go on to old business. Any old business to come before the board? Any new business? Yes, go ahead, Mr. Akers.
I do. In December, we had a 30-year-old employee that retired at the town of Madrid, our clerk. And I asked Dylan and Ruth and Kelly if they would produce a certificate so that I could present it to this individual at the Madrid town meeting. And I'd like to read it to you because it comes from us, it comes from the Board of Legislators. Certificate of recognition. This certificate is presented to Judy Hargrave in recognition of dedication and outstanding job performance during her honorable career as 30 years as clerk and tax collector of the town of Madrid in St. Lawrence County. The St. Lawrence County Board of Legislators admires your faithful service and duty to the people you serve, and your efforts have earned you the respect and appreciation of your colleagues, as well as the gratitude of the citizens of the town of Madrid. Congratulations on a job well done. In witness whereof, we have caused a certificate to be signed this 4th day of January in the year 2021. Thank you.
Thank you, Mr. Akers.
I'd like to thank Kelly for putting this together.
Good job, Kelly. Miss Haggard, go ahead.
Firstly, I've had personal interaction with Mrs. Judy Hargrave and happen to know that she is a wonderful person besides being a dedicated public servant. I was so happy to hear that, Mr. Akers. I would like to know if it would be possible to hear from the sheriff about either the amendment process or could he postpone how we might be able to address our citizens' concerns? I did vote in favor of sending our report from the sheriff to the state, but on second thought and hearing from the public this evening, I'd like to know if there's any process by which he can either amend through listening to people's input, and if he would be able to do that at one of our upcoming meetings.
I can say that we all heard the sheriff's explanation the last time we met with the sheriff on that issue. And he spoke quite strongly about wanting to get that thing done. He put an awful lot of work into it, and he sounded to me like he thought that he'd given ample time for people to discuss it and discuss the pros and cons and to add input. But if you want further response from him, it's okay by me if it's okay by
Bill, Mr. Chairman.
Mr. Akers?
The sheriff is right there. He may like to comment possibly. In the upper right-hand corner is the sheriff.
Okay, Sheriff, I missed you up there. You didn't see your badge. They don't have my long-distance glasses on. There you are. How you doing?
Good evening.
Would you like to address this?
Sure. So there was a resolution on this and it has been passed. So that's something you're going to have to parse out with your legislators. I will reiterate that this has been around for 7 months plus, and there was public comment that was out there. We advertised it on Facebook. We advertised it on our app. We advertised it in the papers. So I don't know what more I could do than go door to door and tell people, but it was out there to the public, and some people did comment from the public with letters, emails, with personal phone calls to myself or my office. So others received the public notifications and did respond to me either in, again, in phone calls or in person. There's some people that did come into my office and speak to me in person. As always, I have an open door policy and anybody can walk in at any time or, make arrangements with COVID, obviously, and call and talk about it. So this wasn't like it was, it's been a month by month process. There was a large stakeholders group that was an array of people in business and private organizations that were helped develop this. And so if you know the executive order like I do, it's a 120-page plus document. And I can tell you that I read page by page, word by word, and addressed all sections of the order, come up with a plan, come up with some corrections, and we already have many of those changes in there. The obviously COVID is restricting some public input. There's no doubt about that. But that being said, in the future and in that document, you will see that I plan on having town halls, regional town halls, where this is not going to be a one-off. People that want to speak on either police reform or other issues with law enforcement or with the sheriff's office, they can do that. And that's my plan for the future. Obviously with COVID, we're trying to get through it. When we get through this pandemic, we can free up some more time to have more discussions. But a lot of things have happened behind the scenes. I have had meetings with all the chiefs in the county. We've come together several times, had many discussions. What fits for a blueprint for the sheriff's office won't really work for all the other municipalities because they have different concerns and different things that they may offer or not offer compared to the sheriff's office. So it's not like everybody can come together and make one police reform document for the county. It can't be done that way. And it doesn't want to be done that way. And the governor doesn't want it done that way. He wants each municipality to do their individual police reform. And it kind of spells out that we can't come together and do one document because that's not what he wants. He wants each municipality to run their own police reform. So I feel very confident of what we've developed, my administration. It wasn't a 1 month, I put it together thing. Again, I started in June, worked day and night on this sometimes. I put a lot of hours, a lot of time. My administration has. We've reviewed it. Again, I went through page by page of the executive order, and if you ever want to read it, it's on the web, and you will see many of my report and presentation was right kind of page by page as what they were asking for. I mean, I try to hit every bullet point, for lack of a better term, of what the governor wanted to have done. Now, again, I will reiterate, and I've reiterated to this board, that our accreditation that we just received in September checks a lot of boxes. It does. It's like 90% of what the executive order is all about is completed with your accreditation. You can read the document, it's in there. So we had, I'm just estimating 10% of what needed to be done as far as review, changing policies, in which we did, changing training, in which we did. We've already established and still will continue to continue with more training next year. You can't do it all. And you're not going to get this all done in a couple months. This is the training that has to be done is going to take a year or two to complete, which we will enact next year in 2022. It's a continuing thing. It's not just the document's done, you stop it, it's all over. It's continuing training, it's continuing education, it's continuing public input, town hall meetings, phone calls to the public. They can set up meetings with me to talk about it. This isn't done because the document is done. It's a fluid situation that will continue, and I will monitor as I go forward. Hope that answers.
Thank you, Sheriff. Go ahead, Ms. Haggard.
Oh, thank you very much, Sheriff. And I was privileged enough to be at some of the meetings that you had. And I do not doubt, I totally know that you put a lot of hard work and dedication into that. I would never question that. I'm delighted to hear about the meetings that we're hopefully going to be able to hold going forward. And that may give people the opportunity. It sounds like something would evolve and change based on input, not necessarily this particular thing, but you'll probably have to do it on an ongoing basis. And with your meetings, you'd be able to get proper input. So I appreciate you addressing us tonight. Thank you very much.
No problem.
Any further questions? Any more old or new business? Move on to committee reports. Any committee reports? Go ahead, Ms. Carr.
So in 2020, they had 106,721 calls that were handled by the emergency services dispatchers, including 911, EMS, New York State Police, and the Sheriff's Department, and one text to 911 for hearing disabled. But the fire dispatches for the year, 4,087, EMS dispatches, 18,083, local PD, 3,834, New York State Police dispatch by St. Lawrence County, 2,932, informational calls, 13,183, and sheriff's calls for services, 12,731. So I'd like to thank all of the fine men and women who take care of these calls, answer these calls, go out to these EMS sites. They do a lot of work, and I'm very proud of each and every one of them. I'd like to say thank you.
Thank you, Legislator Kern. If you recall, I gave a jury board report about a month ago. And at that time, I had mentioned that we have an issue with our jurors in terms of the shortage that we're experiencing. And we were wondering how to fix that problem during during the last jury board meeting. And since that time that I reported to you, letting you know that there was this juror shortage, the New York State Judicial Administrative Office had decided to start the process of having the ineligibility period reduced to 4 years. This means that the jurors will be able to serve again after 4 years instead of the 6 years. So that helps the situation. So what we did was we sent our votes in from the jury board in favor of the reduction. So we no longer have that issue possibly in the future. Executive session. Ruth, is there a need to go in executive session for all 4 categories?
Yes, there is.
That's litigation, negotiations, personnel, and appointments. Anyone? Mr. Forsyth makes a motion to go into executive session. Mr. Kern, Mr. Smithers seconds it. All in favor of going into executive session?
Aye.
Anyone opposed? Anyone opposed? To the Services Committee. The St. Lawrence County Planning Board, terms to expire December 31st, 2023. We have 2 people who will be appointed. That'd be George Blatchley, County Route 7, Hammond, and Dan Huntley, 297 Post Road, Canton. For reappointments, we have for the Planning Board, term to expire December 31st, 2023, we have Kim G. Bisnet, 1005 State Highway 310, Canton. And then for the Environmental Management Council, terms to expire December 31st, 2022 will be Sue Rao, Messina, and then Lance Rudiger, 54 Court Street, also to the Environmental Management Council, and Gerard Tazi of 12 East Main Street, Canton. Is there a motion for all those? Are you in favor of all those, or any questions or issues? All in favor?
Aye.
Opposed? Okay.
Move we adjourn.
We got one more thing. I'm going to make an appointment for the Community Services Board, and that will be Rita Kern, because of her experience in the mental health world. And they're meeting tomorrow, so I'm making that appointment tonight. Other appointments will be coming forth within the next 10 days. And Mr. Akers, go ahead.
Just a question, if you're finished, Mr. Sheridan. Ruth, do we need a new resolution for the deductions that legislators make voluntarily, of course, for the employee contributions?
Can I speak to that?
No, we should, go ahead.
The standing resolution, I believe, addresses that to happen on an annual basis, so we reach out and make sure everybody affirms that and signs off on it again.
So will it require a resolution or not?
I can check the resolution, I don't think so. I think it stands until the board adopts a different policy.
Okay, thank you. That's all I have, Mr. Chairman.
Being no further